like an IT guru.
What's this button do?
Yeah, exactly.
Where were you this morning? I saw that on email.
We ready? Okay. Good morning, everyone, and welcome to the second press briefing. We indicated to you yesterday that we would exercise the optional 11 a.m. briefing if we found it necessary to do so, and obviously the landscape shifted out from underneath us yesterday with the first positive test found here in Blackhawk County. And so without further ado, I'm going to bring forward our health partners and start off this morning by introducing you to the Director of Public Health here in Blackhawk County, Dr. Nafissa Cisse Egbuonye.
Good morning. As you all are aware, we have our first confirmed case in Blackhawk County of COVID-19. The case is a travel-associated case. As was announced by Governor Reynolds at her weekend press conference, we will not be releasing age range of cases and will not release any additional information about this case due to the HIPAA, which is the Health Information and Probability and Accountability Act. Blackhawk County is working with the Iowa Department of Public Health to identify close contacts of the case and implement isolation and quarantine. The social distancing recommendations remain the same at this time, as recommendations for communities experiencing cases were implemented statewide. Again, I am asking the community to please stay calm. I know this is difficult. I know there's a lot of questions. I know there's uncertainty, but I'm urging the community to please stay calm. We are continuing to monitor the situation locally, and we are working closely with our healthcare and response partners. I want to emphasize the preventative measures that are necessary. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. And if you are sick or if you have mild symptoms, stay home. Stay home. Cover your mouth with your upper arm or tissue when coughing or sneezing. Clean and disinfect frequently touched objects and surfaces. And social distancing is critical for people of age 60 and older, and those with also underlying conditions. People are most infectious also when they are experiencing symptoms, especially high fever. So that's why we are recommending for people to please stay home when you're sick. And again, if your symptoms, if you're symptomatic, call your healthcare provider so that they can properly examine your health records and ensure that the proper care is provided to you. Thank you.
Thank you, Dr. Egbuonye. I'm Dr. Matt Sojka, Chief Medical Officer, MercyOne, Northeast Iowa, and agree with everything that she said. We have to be aware that just stay safe. That we're following our protocols and safety practices in our facilities to protect our staff, our patients, our providers. And we will continue to do that and be vigilant on the personal protective equipment. We are being careful with that, and we have ceased our elective surgeries. Talk to your surgeon about those, but we've done that to protect our resources. We are limited in what we will have in the area, blood products, and gowns, masks, eye protection as we move forward. We are not allowing visitors going forward. There will be exceptions to that. Hospital, children, maternity, mother-baby area, and end-of-life care for compassionate needs. But we're trying to prevent the exposure of the community to the rest of the patients and the patients to the community. We have started entrance assessments where we're asking questions and screening for temperature. I was screened today as I came in for my temperature. I wasn't yesterday. So even here at Black Hawk Public Health, we're starting to implement those things. So these are being done for everyone, MercyOne colleagues, providers, patients, visitors, and vendors. So going forward, we want to keep calm about this. Wash your hands. If you're sick, stay home. Cannot agree more with the rest of my team here. Thank you.
Good morning. I am Dr. Russell Adams. I'm the Chief Medical Officer for the Allen Health System and Region. I agree with everything that has been said previously. This is a community effort as we treat or deal with this virus. We know that there's no treatment. We know that we don't have a vaccine. So this is a community effort to control this virus. We want to, in our treatment, decrease the risk of people obtaining this virus. Our best way of doing that is with the initiatives that have been taken by our facilities, and that is to decrease the contact of others with others so that we don't transmit. We know that even if we are in our 20s or 30s and we have a cough and a sneeze, we may be standing next to a person who is 50 or 60 years old that has a lung disease or a heart problem or has a problem with their immunity, and that we could transmit a virus to them. And so that is why we talk about social distancing, which means the 6-foot distance between our neighbors. It means that we need to communicate by social media so that we can keep in touch with our friends and family. It means that we need to avoid being in crowds. That is one of the most important aspects of this. This is a community effort, not only in our community, but in communities throughout the country. And I truly believe that as we attack this as a community, we will be successful in decreasing the risk and the prevalence of this virus throughout our community. As has been stated before, it is very important for us to practice all the techniques to keep ourselves safe. And that is that if we're sick, we should stay home. If we feel that we have a cold or cough or shortness of breath, we should contact our care practitioner. They will give us guidance as far as what our next step should be. If we're not seriously ill, we should not present to our clinic without contacting our practitioner. We should not present to the emergency department or to urgent care until we've contacted our care practitioner. The reason for that is that if we do have a virus, we do not want to spread it to others. And so our care providers will give us an indication of what our next step should be. Thank you.
Hello, I am Dr. Sharon Duclos, Co-Medical Director at People's Clinic. So just to summarize, I agree definitely with what everyone has said. I'm on board with that. People's Clinic is on board with that. To kind of sum up, one of the things that we have really focused on at our clinic is really talking about the mental health of people as you go through a pandemic. A lot of people don't really discuss this, and I think it's very important. So when something out of the ordinary happens, in this case it's a pandemic, things are unsettling. They're outside the norm, and so people walk around and they feel unsettled. They don't feel normal. And as you feel unsettled, that little hair in the back of your head starts to go up, where you feel like you're constantly trying to swallow the panic that you feel. And so the unsettling feeling that you feel is normal. So just realize that. And this too shall pass. This virus will run its course. We will get through this. And if we all work together, we will limit the severity of the virus. And that's what we're all trying to do. So the less panic, the better we are in order to help the majority of people that we need to help. So the unsettling feeling that you feel is normal. It can be exacerbated when somebody feels panic, and that's what happens when you go to Walmart, and then all of a sudden somebody's buying toilet paper more than what they could use in 6 months. And so when you see somebody start to do that, inside, you start to panic. You start to think, what do they know that I don't know? Oh my gosh, there goes all the toilet paper. I've got plenty of toilet paper back. I better get me another toilet paper. That's what your brain starts to do, okay? Toilet paper, canned goods. Production, it's all gonna come, it's coming. Do not panic, take a deep breath. We are going to be okay. So, ways to fight your anxiety. Number one, be careful with always looking on social media. When this comes at you 24/7, your brain does not get a reprieve. It's good to get information. Go to accurate sources. Black Hawk County has a website, beautiful, gives you accurate information, which is important. The CDC has accurate information, which is important. Social media does not have accurate information. So beware. So what you're gonna see too is on the news. When I watch the news, 95% of what I watched last night had something to do with the COVID virus. That was the first story, it was the second story, it was the third story. Thank God for the weather, because last night nothing was said about the COVID virus, so I felt a little reprieve until we got to the sports, which had something to do with the COVID virus, and the follow-up was the COVID virus. So for 30 minutes, I got to listen to that. Then I gotta turn it off. Now's a good time, get a big old bag of popcorn, turn on an old movie. Get yourself away from the media then. And that will help with your anxiety. Get enough sleep, that's very important. Eat healthy, fruits and vegetables, lots of antioxidants, that helps your immune system. Exercise. You can stay 6 foot away and exercise from a lot of people. Trust me, that little COVID virus is out there, it's not pounding the pavement, so you can get out there, do some walking, get some fresh air, and get that exercise to help your immune system. So that is what I task you today. Exercise, sleep, and eat healthy. We will get through this.
Thank you, Dr. Duclos. All right, she mentioned our website resources. I'm gonna mention that to you again. blackhawkcovid19.com. It's updated in real time. So very quickly after we were notified that we had a positive test case here in Black Hawk County, that website was updated. That's our best way of communicating in real time with you. We also have social media resources. We also are actively partnering and communicating back and forth within the Emergency Operations Center. But pay close attention to those real resources as were referenced by our medical professionals here. At this time, that concludes the actual brief, but we certainly open ourselves up to your questions.
This question is for Nafissa. Why is it that you're not releasing an age range?
These were the recommendations by the Iowa Department of Public Health.
When we say travel related, I feel like that's kind of evolved in the last few weeks. Is it travel internationally? Is it domestic travel? Is that something you can release?
That's not information I can release at this
Okay.
moment.
Do we have any kind of concern? I know you said you're contacting people in the community who might have come in contact with this person. Do we think they were possibly symptomatic being out at a restaurant or a grocery store or something? Is there any specific location that people need to be aware of that they might have interacted with someone? I know the DJ at Long Range.
Yes, the investigation is still going on, and so that is part of disease investigation where we interview people and ask questions.
Okay. This is probably a question more so for the hospitals or some of the other providers. There's been a lot of talk, I think, in the last 24 hours especially, about resources and ventilators and things of that nature. The president, in fact, just moments ago, established the Defense Production Act to start getting some more of those resources come in. Are we secure in Black Hawk County in our resources?
At this time, we are secure as far as our resources, as far as ventilator use is concerned. Both of MercyOne and Allen have basically looked at what our resources are within our community. We also have critical access hospitals that will help us if we are short on resources. We have different action plans in place on how to manage patients. One of the reasons for not having elective surgeries is that sometimes an elective surgery is associated with the need for a ventilator. and so we are not having elective surgery so that we have the access to ventilators if we need it. And we will monitor this on a daily basis, and in fact throughout the day, both organizations, to assure that we have the resources available.
Sure.
And how many ventilators do you have? MercyOne gave this information yesterday.
That is a question I don't have the answer to.
You mentioned a moment ago that folks should call their primary care provider, and I think the last time I did an interview with UnityPoint, we know about 65% of people have a primary care provider, but that's still a good, chunk of people who may not. I didn't until, maybe 6 months ago. What advice do you offer to those folks who may not have a regular doctor that they go and see?
Then I think that they need to reach out to the resources available, which would be health department, would be calling their family to see who their health provider is and to see if they can contact them. The other part of this is that we should attempt to always have a care provider available to us, but there are resources available. We oftentimes will have patients that will call our urgent care clinics, and they will ask for advice from them, and that's also an option.
Now this question is for Dr. Matthew. Did you mention that you had a possible shortage of gowns and masks and blood supplies, or that you were anticipating?
We are
shortage?
anticipating that, and we're trying to prevent that, so we're securing the resources. One example would be blood products are a little bit lower than our normal supply, about 80%. Still plenty to do everything we need to do on a day-to-day basis, but because of the COVID, we're asking people not to donate if they have symptoms, because we can't test for it, and therefore we want to protect the population.
So nobody's able to donate blood at this time?
If they don't have symptoms, they can donate, but there is criteria out there per the Red Cross.
Probably a question for Nafissa. This current, this latest patient here in Black Hawk County, do we have any information on their condition? Are they doing well? Are we fearful for complications? Are they hospitalized? Anything like that that you can share?
Due to HIPAA, we cannot.
Okay.
This is all based on it's for the patient.
Okay.
President Trump had mentioned relaxing HIPAA privacy rules. Would that affect any sort of information that you'd be able to give us, or are you still just waiting for state guidance on that?
My direction is from the Iowa Department of Public Health. And it's important for us to always remember that the patient is first.
One other thing for you, if we've got one case now confirmed, are others being tested? Do you have any numbers on others that might be?
For the confirmed case, we're doing disease investigation, and so we follow up with those contacts.
You had mentioned mild symptoms. People with mild symptoms should stay home. Is this a new guidance?
No, I will, depending on what new is. I mean, we're getting guidance within, but this hasn't been a new guidance. I mean, this is a guidance that's been out for, I think, a couple of weeks now. So, and that's important. The self-isolation is really critical.
I will tack on to that. So I think the biggest new for in a pandemic is, we talk about it at our office all the time. I had my provider call in this morning. She had a little bit of a scratchy throat and just a mild cough. She didn't have a fever. And so normally it's like, I have a little bit. I think I can work through this. She would normally come. Normally wouldn't even make the phone call. But now you're kind of in a cycle where you're being extra cautious. So mild symptoms, I want my provider to stay at home. I want my staff to stay at home. Let's be extra cautious right now. Give yourself a break so you can get better. So God forbid if I need all my providers because we have a run of truly, really sick people, then they're available. So I can tell you we've had kind of that shift in trying to talk to our staff about, because these are everyday illnesses. So we get them all the time. There's lots of viruses out there. It's just, this is a new one, and new ones when they come through, nobody's immune. And so that's why you see this big peak of a lot of people getting sick with that. And so the other thing I always say, because my staff is asking too, everybody wants to be tested. I would just feel better if I'm tested. Testing does not cure the disease, okay? Testing is not going to change treatment. The treatment is the same. Go home, isolate yourself, get a lot of sleep, eat the chicken noodle soup, Tylenol for the achiness. Isolate yourself from your family members so hopefully you don't spread it. If somebody is sick at home, clean a little bit more often those countertops. So that's the recommendation, but those recommendations will not change whether you're tested or not, because that is the recommendations for all viruses that you get. So just remember that. There's no reason to feel like you gotta run out and get tested. There's no testing kits, what do we do? Well, we're telling you what to do, okay?
Kind of tackling on that a little bit. I feel like with so much questions in terms of economics, I know personally at the station, you know, we've got a plan in place for if one of us becomes ill, but it's kind of that same scenario where you have to have a doctor's note. You have to have documentation, which would require a test. How should people kind of balance that if they're trying, you know, if they want to get tested and they're afraid they have it, but, you know, work requires that, but we don't want them to be out in the public? I feel like there's kind of a lot of a balancing act that has to be done there.
Well, I think as you're aware, there's been a relaxation with employers as far as when you're sick, they do want you to stay home, and that's part of this effort. And so I think at this point in time, I think it's really reaching out to the employer and saying, I'm sick with this, because their directive is to stay at home. And then I would think that most employers will say, stay at home, we don't want you to come here and infect our other employees. We want you to get well at home, and that's how that would be handled. And I think that's with most of our organizations now.
Can we reiterate the guidelines that we want people to follow?
Okay, so the prevention guidelines, again, social distancing is, and for people who are 60 and over to stay at home, and those with underlying conditions. We also want to practice the 3 C's. So wash your hands, cover your mouth with your arm or a tissue, and also containment. Please stay home if you're not feeling good. Please stay home. That's very important. That people understand that. And I just want to emphasize the Iowa Department of Public Health has also sent out recommendations to businesses to also be very accommodating of people that are feeling sick and not requiring a doctor's note.
If there are no further questions, again, our normal briefing is always at 3 p.m. and we will have a briefing at 3 p.m. today. We don't anticipate any earth-shattering news between now and 3 p.m. So it may be a regurgitation of some of those same information. So bring us your questions. We certainly are willing to stand flat-footed and answer those questions. And I think that's probably one of the more powerful pieces of this interface, because I know that the public is pining for information, and probably one of the more valuable pieces is the ability to have professionals that can answer those questions for you. So certainly do your homework and bring those questions to us. We're going to continue to emphasize, even though we have a positive case, we're going to continue to emphasize those prevention strategies that will continue to help keep our communities safe. And that's one of the biggest reasons why the Emergency Operations Center is in place right now, so that we can help stem the spread and flatten the curve, as they say, with the spread of the COVID-19. If there are no further questions, that concludes this briefing, and we appreciate your attendance. We look forward to seeing you back here at 3 p.m. Thank you.